Welcome, everyone. My name is Lisa Lunghofer. I am the Executive Director of the Gray Muzzle Organization, and we are delighted to have Dr. Mary Gardner with us today, who's going to be our presenter. And for those of you who have joined us previously, you've probably seen one of her talks before. And I was just saying before we jumped on publicly that we have had such good feedback from Dr. Mary's talk, so I'm sure that you'll enjoy what she has to share with us today. I'm also joined by my colleague Amanda Grant, and Laura Merrick will be fielding questions. So we'll have hopefully some time for questions at the end. So please feel free to type your questions in the Q&A box if you're joining us on Zoom, or in the comment section if you are joining us on Facebook, and we will be sure to get to as many questions as we possibly can. So before I introduce Dr. Gardner, for those of you who may not be familiar with Gray Muzzle, we provide funding and other resources to animal welfare organizations across the country. Last year, we awarded $616,000 in grants to 77 animal welfare organizations, and we'll be announcing our grant awards for 2022, 2023 in the next couple of weeks. So I'm excited that we are optimistic about being able to award even more in grants this year. Right now we have a live auction going on through Sunday. So you can learn more about that at graymuzzle.org. The money that we raise will go towards those grants. So in addition to the grants, we also provide resources to the public, and this webinar series is part of that series of resources. So let me introduce Dr. Mary Gardner, who has a special place in her heart for the skinny, wobbly, gray-muzzled pets. She's passionate about geriatric care and is a veterinarian and co-founder, excuse me, of Lap of Love Veterinary Hospice, a nationwide practice whose 200 or more veterinarians provide in-home hospice, euthanasia, and end-of-life care. She's a published author and co-editor of the textbook Treatment and Care for the Geriatric Veterinary Patient. And in January of this year, she published her book for dog owners, It's Never Long Enough, a practical guide for caring for your senior dog. And I have to put a special plug in for that because she sent me a copy, and I meant to have it here to hold up for you, but it is a great resource and has all sorts of just amazing information. So please do check that out. Dr. Gardner travels the world speaking about geriatric medicine, assessing quality of life, veterinary hospice, euthanasia, and caregiver burden. A 2008 University of Florida College of Veterinary Medicine graduate, she was awarded the Angel Award for the recognition of the human-animal bond. She also received the Alumni Achievement Award from the University of Florida in 2016. And she is just an all-around terrific human being and a member of our Gray Muzzle Advisory Board. And I'm just delighted that you are here speaking to all of us. So with that, I will turn the virtual floor over to you, Dr. Gardner.
Well, thank you, Lisa, and all the members. This is my favorite organization because I do have a special place in my heart for the older pets, especially those that need a forever home. And you guys provide such a great service. And so anything I can do to help not only your organization, but your members and the people that follow you. And I know that so many are struggling with end-of-life decisions if they are following you, right? And so I've done a couple of webinars, and I thought this one I would like to concentrate on a tough topic, and that is, what is euthanasia and what are the options that a family has? And this is definitely an emotional decision to make, and one that I honor and I respect, and I know that not one answer is appropriate for every situation, every pet, every family. And so I just wanted to openly and honestly talk about euthanasia. Everything from what's involved to even the medicine and reactions that you may see and things like that, because I think it's so good to just be aware of the options and aware of what it really is, because so many people have misconceptions or they're scared. And always in my hospice conversations, I talk about euthanasia because I want to understand what we do want. So many people, Lisa, tell me what I don't want. I don't want my pet to be at the emergency clinic. I don't want this to happen. But let's talk about what we do want. So I'm just going to go over first, what is euthanasia in itself? So euthanasia is, it's a Latin term meaning good death. And it basically means that we will end the life of a pet before they naturally die. And I will talk about natural passing at the end. And it has been around for decades of doing euthanasia. Even listen, our food animals are euthanized. So those that we use for our consumption, they're euthanized in the food animal industry. So euthanasia has been around for a long time. And it's definitely something that more and more people are leaning towards because pets are in the home, they're on our bed, they're not just out in the backyard, hiding underneath a bush somewhere until natural death happens. So that's the technical word for it. And what I want to talk about now is how that works. And again, I know this is a sensitive topic, and I do hope that talking about it actually breaks some of the mystery behind it. So the actual act of euthanasia with the medicine that we provide, that final medication that we provide, is an overdose of anesthesia. And what that does is when we give that medication to a pet, it travels to the brain. The brain is what's in charge of all the organs and muscles and reactions. The brain is pretty important. So when that brain shuts down and permanently shuts down because we've given it such a high dose of this medication, it no longer is sending messages out to the body. It's no longer saying breathe. It's no longer saying move your organs. It's no longer saying heart to pump. So all of the messages that are already out in the bloodstream get used up. And when they're all used up, all the other organs follow. So the pet will no longer breathe. The heart will stop. The muscles will all the muscles relax. And that's an important point, which I'll talk about. So we're really actually shutting the brain down. And I tell you this because so many people think that we're giving a heart attack or we're stopping the heart. We're actually stopping the brain. So there is no pain involved. There's, the pet doesn't know it because they go unconscious first. Pain and suffering requires consciousness, right? So if you have ever had a surgery and you've gone under anesthesia, you actually don't remember the surgery while you're not present. You don't hear things, you don't see things. When you wake up, you may have pain because you've just had surgery, but during it, you're not feeling anything. That's why we do anesthesia, right? So this overdose allows the pet to not feel anything. The medication itself doesn't hurt. Again, it just stops the brain, and then all the organs just slowly shut down and use up the energy that it already has until the pet has technically passed. So that process, once it hits the brain, usually happens within a minute or two. It's fairly fast. There are times when a pet may have a bad circulation. So when we give the medication, it doesn't travel as fast throughout the system. That is very normal. And so it may take a little bit longer. Now, after a pet has passed, remember I said about the muscle relaxing, everything relaxes. That means that their bladder relaxes also, and they may relax, they may, go to the bathroom on, just things come out. That happens to us, by the way, when we pass, right? So they may go, pee or poop may come out. But a big thing that I want to always tell all the owners that we help is that the eyelids are actually in a relaxed state afterwards. It takes an active muscle to keep your eyelids shut. And when the brain is no longer sending messages to keep the eyelids shut, they are actually in a relaxed state, half open, just in a half open, relaxed state. So when you see movies, when someone closes the eyes to a person that has passed in the movies and they close them with their fingers and they say, that's actually not true. That doesn't happen because it takes an active muscle to keep them shut. So that I tell you that because a lot of people get a little bit concerned when they see that. That may be startling to them. So it's absolutely normal, and you can't close them unless you were to hold them down for a longer period of time. And then when rigor mortis sets in. So I just like to talk about that because that is a reaction that you will always see. That reaction of the muscles relaxing will happen. What about other reactions? Because I know that some may have experienced a difficult euthanasia in the past because their pet may have had some reactions during the process. So these reactions do happen in even natural passing. They happen during anesthesia. That's what we're doing, right? They happen in humans. So some things that you may see, and this is very rare, it happens 3% of the time or less. You may see your pet have a seizure. You may hear vocalization, and that usually happens at a certain plane of anesthesia, even in humans. So I have had so many surgeries, and I start talking a lot when I'm coming out of anesthesia, and it's an inhibition, and so that is your pet vocalizing, they're chattering, but that's upsetting for people to see. So I'm not saying I understand why it's upsetting. You may also see some rhythmic breathing changes, so they just may breathe heavier before they start to slow down. That's nothing abnormal. And you also may see, stretching, or a lot of times we'll see more often little muscle tremors. And that again is just the little electricity getting used up. And so all of these are normal, but there can be shocking to somebody. So just know that there's nothing wrong at all if your veterinarian has done if these things happen. Another big shock to some people is it's called an agonal breath. And I don't like that word because it says breath, and it's not actually a breath. What happens when the body shuts down, your heart is shut down. Remember, I've said from the beginning, all the muscles relax. So your heart is a muscle, it relaxes. Your diaphragm is also a muscle. So your dog's diaphragm is a muscle. And when that relaxes, finally, it can push air, it actually pushes air out of the mouth. And sometimes as the jaw drops down, that air coming out, it looks like they're gasping, and it looks like it's a breath. It's actually, they've already passed. It is just muscles relaxing, but that startles some people. And again, happens less than 3% of the time, but when it happens to you, it can be upsetting. So we try our best to prepare owners. I only prepare owners for their bladder relaxing. So I'm going to always put a little wee-wee pad or a diaper, if you will, or a towel underneath them. And the eyes. I always say the eyes are not going to remain closed. If anything else happens, I'll explain it at that time, because I don't want to startle people with, hey, they could have a seizure, they could do these 10 things when they normally don't happen. But if they do, then I can explain it kindly, so that way, hopefully they understand. So before that medication is given, so actually the medication that we use, the overdose of anesthesia, it travels in the bloodstream. Most of the time, it is given in dogs in a leg vein. So we call these peripheral veins. That's the most common way, but it can be given in other ways. So if you've ever had a doctor that has given your pet the final medication in other ways, that's okay. There's nothing wrong with that. And believe it or not, actually, that is what I do for my own pets, because I am the one that euthanizes my own animals. It's very difficult, but I think I'm the best at it. And I think I want to be the ones to deliver those angel wings. And I find, it's a little bit comforting to me to know that I'm the one. I want nobody around. I want to do it myself, but I want to be hugging them. I want to hug my pets as they take their last breath, and as I hear their heart stop, as it slows down. And if I'm giving that medication in the vein, it circulates very fast. So if you get it in a leg vein, it happens super fast. So within a minute, they're passed. And again, I want to hug them. So what I do is I actually give it I just put the needle through the skin into their liver, and we call that intrahepatic for a fancy word. And we can actually give that medication in all of the organs that blood flows through. So the kidney, even just in the abdomen or in the liver. And that's the place that I give it most often. And what that does is it slowly travels to the brain. So it's going to take a little bit longer. So I'm able to put my medication aside, and then I can snuggle my girl or boy and love up on them while they're slowly passing. So that's just me personally. Some people want fast and some people want a little slower. So we are able to do that. I had one woman in Southern California where we go to the homes, right? So at Lap of Love, we go to homes to help families say goodbye at homes, but she didn't want the one spot to remember where her little Shih Tzu was going to pass. She didn't want it on the couch or on the bed, or she just could not have that one spot. So, the little Shih Tzu had cognitive dysfunction, so like doggy Alzheimer's. And so every night she would carry him around the house in her arms until he fell asleep. So I said, well, I could give it actually in the liver, and I'll just step away. I'll step away, and you walk around the house until he passes. And she loved that idea. So none of these ways are wrong. And that's so important to know. It's totally fine to do that. What I think is important to talk about, though, is before that final medication is given, do we want to sedate the pet beforehand? So remember that doesn't hurt the pet at all, the second medication. So it's not, the final medication. So it's not an obligation for us to sedate the pet beforehand. However, I prefer to. Not every veterinary does, and not every situation can allow for it. If you've got an emergency situation and we have to euthanize quickly because the pet is suffering, then we need to act quick. So I like to give sedation, and all of us at Lap of Love, it is a requirement that we give sedation beforehand. So that way we give the sedation first. It's a little injection under the skin, like a vaccine, nothing big. And they're still awake for a few minutes, and then they slowly will sedate. So they could be having cupcakes or bacon or whatever you want to give beforehand. And then they slowly sedate. And when they're calm and comfortable from that first medication, then we give the second medication. So again, it's not a requirement, but I personally like to sedate first. And this is either in the home or at a clinic. When I used to work in general practice, I would always sedate first. But I've had one person that said they wanted to be looking in their pet's eyes and have them fully aware when they were euthanized. And so that's okay. But typically, I think it's very helpful for the pet owner to not be so fast, and just have a transition period from being fully awake to sedated to sleeping and snoring before we say goodbye. But that is it's sometimes not always done. And the veterinarians in the United Kingdom, it's actually they more often than not don't sedate. Again, it's not a legal requirement or ethical requirement or anything like that, or a medical requirement. It's just experiential. That is what I prefer. So that's the technical stuff. And I know, like I said, it can be a little heavy, but I just think it's important for you to know that it's, how it technically happens, and what happens, afterwards if something happens, and why. So what about where? Now, as an in-home euthanasia veterinarian at Lap of Love, we of course prefer in the home. That's what we do. So in your home, if that is where you prefer, it could be done anywhere. It could be in your bed, in their bed, but wherever they're most comfortable. So if your dog has mobility issues and they're kind of restricted to the first level, don't try to bring them upstairs to be in your bed. Like, that's not the best option for them. So where they're most comfortable now is really important. It could be on the couch. So many times we're outside, beware of weather and things like that. And I'm in South Florida, so in the summer we're all sweating outside. But I lived in California, and sometimes it was hot out there too. But so where in the house is something for you to think about as you're planning if you were going to do something in the home. I've actually euthanized one person. I drove up to their house, and the dog and the owner were in their car. And I said, hey, what are you guys doing? She goes, well, he loves the car. So I brought him for one last car ride. And so I said, well, I could do this in the car. And so we actually let the pet stay in his favorite place, which was the car, and we euthanized him there. I have helped families at parks and beaches, but know that, you know, it's good to just be separate from the public and not have, you know, and have your privacy. So I do prefer in the homes. And then when? Now, when is really important. And this is tough. And I think I've done another lecture for the gray muzzle about quality of life. This is something I talk about all the time. You can find it on my YouTubes because it is the most common question I get is when do we say goodbye? And that is a whole hour topic in and of itself. But you know, dare I say it is always going to feel too soon. Always. But I much rather have a week too early than a day too late. And because if you don't prepare and we wait to the very end, it may not be as peaceful as we want. At Lap of Love, my goal is a peaceful euthanasia. And when I first started, I was doing 24/7. Call me 2 a.m., I'm coming. But what I noticed is it was always respiratory distress or something really horrible. And it wasn't a peaceful euthanasia. So I realized that I became their backup plan. I was their emergency clinic, and that's not what I wanted to do. I want the cupcakes and the bacon and the harp music and the songs and the parties. I wanted that. I didn't want to be rushed and having it a rushed experience. So when will always be tough. And like I said, I have a lot of how will I know is time information for you while you're struggling. But I know how difficult that is. Now, planning for this is also, you know, who wants to be present? And you may want to be only you. Like I said, I actually prefer for myself. I don't want anybody else there. I don't want to hear anybody talk to me about how great they're living, like how well I've taken care of them. I just want silence. I want to only talk to my dog. But with that being said, I've also been a part of wonderful parties, like send-offs. The one I remember most, and I have it in my book, is Jupiter. And I pulled up, and this is in Southern California, and I pulled down the street, and I was looking for the house number, and I saw this big tent out front, like what you see at art festivals. And I just saw all these people, and I'm like, oh, that's the house I'm going to. And they had the whole neighborhood there, and they had this giant poster board where everybody was signing something about Jupiter and saying goodbye. And it was a big Mastiff. And he had his fellow Mastiff there at the party, and everybody had leis on. They had margaritas, and it was just such a celebration of Jupiter. And so I've been from solo to many people present. Now, what if you can't be present? So I understand that there are some people who may criticize you that says, "How dare you leave your pet alone? Your dog looks for you," or something like that, right? And they're not going to. So if this is difficult for you, I understand. But I will say this though, if you can at least be present for the sedation, that's really comforting, because then you will be the last thing that they see or hear. But if you can't be present at all, bring something with, if you're going to a veterinary clinic, with you that smells of you, because the number one scent that activates the pleasure center of a dog's brain is your smell. So have a shirt or something like that they can have present in the room. So speaking of euthanasia in a veterinary clinic, which is totally fine as well, it is important for you to try to make this plan a little bit, so that way you can do what's best for you, a time of day. And this is actually in the clinic or even at the home. When's best for you? I've had some families that want to do it first thing in the morning because they need the day to just comprehend. I've had some that want to be the last appointment of my day because they want the full day. Maybe the dog is struggling. So same thing within the clinic, because they're not always available to do this. So it's best to make an appointment and cancel versus struggle to try to get in somewhere. And dare I say, the worst place is an emergency clinic. Now, our emergency veterinarians and nurses are amazing, but there's only so much that we could do. When you're at an emergency clinic, it is rushed. There's not as typically a time allocated to make it a beautiful experience. So dare I say, nobody wants to rush them to the emergency clinic, because that means we did wait a little too long. Now, the last thing I want to talk about is natural passing, because I will hear often that somebody says, I just want him to curl in his sleep and die in his sleep, which I hope that of me as well. I hope I had a great pasta meal, some Oreos, and I fall asleep, and I don't feel anything. That's not always going to happen though. And depending on the disease the pet has, they may last a very long time and have a lot of struggles up until that time. So if you've got a dog with mobility issues, they're not just going to curl in their bed and die at 2 a.m. Like it's just not going to happen. You have to make that decision. If they have heart failure or something where it restricts their breathing, sadly, they will suffocate. They will drown in their own lung fluid. It's not a good passing. And if you are not present, you don't know it. You just think that they passed peacefully because they look peaceful afterwards, but it is not. So I really encourage making sure that if you are against euthanasia, because there are those are, that you do what we do in human medicine, is that you allow palliative care and a lot of sedation and pain management, so that way they don't feel the ailments of their disease. I would never want to die of heart failure myself unless I've got a lot of good morphine on board. So I've had some people that are anti both of those. They don't want euthanasia and they don't want palliative sedation. And I struggle with that because I'm the pet's advocate. So that's a whole other discussion. But the other thing about natural passing to consider is it could happen at any time. In the middle of the day, it could happen. It's not always at night. It's not always in their bed. It could be outside, it could be anywhere, and you may not be prepared for it. It also isn't very fast. So sometimes it is, but and we don't know that they're dying up to that point, and then all of a sudden it's the final act is really fast, but they could be dying for hours. A dog in kidney failure is dying for hours. It's not a fast process. They could paddle, their head could stretch back. I just tell people the things they may see, so that way they are not shocked when they happen. And I do hope that Mother Nature does make them unconscious during that period, because I don't want them to struggle. I don't want consciousness to be there while they're passing. The other thing is, I actually want to be present. I want my dog to know I'm there. I want them to, I want to hold their paw. I want to thank them for being such an amazing friend and companion, and be there for them as they pass. And if they die naturally, I won't get that opportunity. And I lost one of my own dogs, Neo. He had Cushing's, and he had adrenal tumor, and he was doing really well on chemo and everything, but he died without me at 2:00 in the afternoon on the day after Thanksgiving. And I'll never forget coming home, and he was all stiff and his arms were outstretched. And I just thought I failed him because I wasn't there for him. I wanted to thank him so much and just be present, make sure he had his cupcake and felt me present. So I share that because even I had my own regrets, and I don't bucket list, do all these wonderful things, because when we do say goodbye, we always wish we had one more moment with them. And that is certainly true of us, right? Even when we plan for the best. So I hope that was helpful. I am open for questions. So, and if Lisa wants to come back and kick them out to me, I might have forgotten something.
Thank you so much for that. Oh, it looks like you got
Long Enough, which is available on Amazon and bookstores, which I go over all these options as well. So if you missed anything or want even more details, I go into it there. Hi, Lisa.
Hey, you know what? I think you got a little stuck when you were talking, when you first started talking. So I think you were talking about your book. Maybe you want to repeat that.
Okay, yeah. So I talk a lot about assessing quality of life, euthanasia options, even aftercare options. So what burial versus private communal cremation. All in my it's never long enough. So I
Lost you again. Sorry. Yeah, we can't hear you.
Oh.
There you go. You're back there for one moment. think we may have lost you altogether.
I'm here.
There you are. Okay.
Okay, I was texting, everybody get off the TV. So,
So we have some questions. Dr. Mary, do you get involved as part of the care team in hospice cases? If so, is there anything different to your process for euthanasia?
we say the beginning part again. Do I get involved?
Yeah, do you get involved as part of the care team in hospice cases? If so, is there anything different to your process for euthanasia?
So I'm assuming this is about lap of love. And so I personally don't get involved unless they're my own patients. So any one of our doctors, though, has our lap of love hospice training. So they all follow the same modality, methodology, everything. And even with the euthanasia, like everything we do is the same. We always sedate and we use the same drugs and things like that. So I personally don't get involved in every case because we have a lot, Lisa. We help a lot of families. I don't think I could do it. I don't know if that was the question, but all of our trained doctors are trained in the same theory and method.
Okay. Caitlin is wondering if you can share a link for your video on how to assess quality of life.
Yes, I can do that. And I could, and I don't know, I know I've done something for you guys, but I will. I thought I did something for you guys.
Yeah,
I'll share. I'll pop it in the chat.
We can also, everybody who registered will get an email with a link to the recorded version of the webinar, so we can include that there as well. So we have a question. I have the most trouble deciding about euthanasia when cognitive dysfunction and/or mobility issues are involved. They are not in pain or suffering per se, but how far do you go in hoisting, etc.?
Yeah, that's a great question, Lisa. So I'll start with cognition. That's tough because depends on their symptoms. If they are completely just, dare I say, sometimes, Lisa, they're like a zombie. They just stand there and they don't know, and they snap out of it and they're like, "Where's my dinner?" Right? And so often they're still doing their favorite things, but they're like a zombie half the time. So those are hard because we don't think they're suffering, right? But a lot of times cognitive dysfunction does have an element of anxiety. They're panting, they're patient, they have anxiousness, and anxiety is painful. So if anybody's thinking about euthanasia right now, you have anxiety. The thought of euthanasia brings anxiety, and therefore you are in pain. So pain is not just the physical, like arthritis. It is a social emotional component to it as well. So if a dog has anxiety because of their cognitive dysfunction, they are struggling. They are having some issues. But the problem is when they come out of it, right? And then you see them well. And mental illness is still an illness. So for those, I want to, where's my line in the sand? Is it that, they're only in that weird state for 10% of their life, but are they in that state for 50% of their life? Like, that's not good either. So we have to kind of make our own line in the sand of what percentage is allowable. Mobility is tough too, because they're usually eating. So if you've got a lab, a golden, a beagle, they're always going to eat, right? They're little food mongers. But mobility is tough because there's still joy usually, even in pain. Pets and humans handle pain better than we handle anxiety and malaise. So if you've got a dog with cancer or kidney failure and they feel like crap, dare I say, right? They're just like, bleh. That's actually, worse, but, bad hips are bad. But they still are like happy and things like that. So they need to be on a lot of good pain management. There are some mobility diseases that actually are not painful at all. So degenerative myelopathy is a big one that happens in larger breed dogs, where the disease itself is not painful, but they're dragging their feet. They can't get up. That there's pain involved with the problem that they've got. But I know it's hard, and a lot falls on the caregiver. This is where caregiver burden takes a big toll. because if you're dealing with a larger dog with mobility issues, that's not easy to keep them clean, to keep them up and moving, to make sure they're not getting bed sores. And cognitive dysfunction, that takes a lot of your emotions. When you don't see them themselves, when they're panting and pacing at night and keeping you guys awake. My girl Sam, at the end, she was starting to get cognitive dysfunction, and she had lymphoma in her spine. So I had both mobility and this. And every night at like 7 at night, she'd start to do the bark and just like, arr, arr. And then at 2 a.m. and at 4 a.m. And I had to sleep out in the living room with her just to calm her down. And it took a lot out of me. So I appreciate and understand how hard that is.
So we have a follow-up question. I think the question is about at what point the Lap of Love team gets involved in care for an animal who maybe has a life-limiting condition. You know, are you part of the hospice process sort of before the final decision about euthanasia is made?
Great question. We are before it. So we are Lap of Love Veterinary Hospice and in-home euthanasia. So that's the technical name. So 100%, and often GP doctors, they don't think they do hospice. When I lecture a lot, Lisa, I'm like, you guys do hospice. You don't know it, you don't call it. But there's a lot to hospice than just the palliative care. It is the, talking about caregiver burden, assessing quality of life. And so all those things I think I talked about the last lecture, right, are all the elements of hospice. So yes, we do. And dare I say, I would rather people come to us sooner than later. And because the sooner we can get a pet in hospice, the sooner we can give them palliative care, they actually live better, which is most important, but they also live longer, better. So yes.
Okay. Laura or Amanda, do you see other questions that I have missed? We have a couple of people who have said your books are great.
That's awesome. I just posted that YouTube so you guys can put it wherever. I've got many. On my YouTube is youtube.com/Dr. Mary Gardner, and I have a ton of videos on there.
Okay. Okay, when you pursue an intrahepatic euthanasia, do you have to give a larger dose of the anesthetic?
No. So we don't have to give a larger dose. What is required by the American Veterinary Medical Association is that any route other than venous is that they are fully sedated under anesthetic plane of anesthesia of sedation. So meaning they're not reactive and things like that. I always sedate the same amount regardless of what route. So because I'm prepared at any time. Because Lisa, sometimes the veins on these older pets are really bad, and we can't get a vein. Did you know that as we all get older, even us humans, our veins may appear to be the same size, but inside they're actually shrinking. They get smaller, so they could be very difficult to get access to. So I always want to be prepared if I have to go any route. There's intrahepatic, so that in the liver, in the kidney, there's also intracardiac, so in the heart. They're completely sedated, and I have done intracardiac a number of times because I can't access any other vein, but that's okay. I think it's good to know that there are some veterinarians that do that by default. It's very easy, and it's totally pain-free.
Someone wants to know when the cat book is coming out.
Okay, so right, my dog book is It's Never Long Enough, and my cat book is 9 Lives Are Not Enough. So that's going to be this fall. So keep a lookout. Follow me on my social, Dr. Mary Gardner, because I'll be making announcements. So.
All right, we'll be sure to share that as well.
Thank you.
I don't see any more questions. Let me just check here on Facebook.
Yeah, I know there's all these different ways to go check for questions. I thank you guys for letting me talk about this, because I think we're a very death adverse society and we don't want to talk about these things, but it is so much better to plan, like I said from the beginning, what do we want? You know, because if we can plan what we want and just say those things out loud in the beginning, then we could make that happen. You know, the worst euthanasias I ever did were the emergency ones. It saddened me. And I'll say also there, one time, I can't remember if I told you guys this before, but one time I went to a pet loss support group. And we have, by the way, free pet loss support for anybody, whether they've used Lap of Love or not. We have a free, every day, basically, we have a pet loss support Zoom going on. But I went to a meeting in person once. This is maybe 9-10 years ago. And I had just let my Samoyed go. So she had Cushing's and diabetes, and it was very sad for me, but I let her go. And I went to the group, and there was a woman there who had been going for a year. She was still going over the death of her pet. And so I told them the story, and I said, you know, I let her go, you know, a week too soon, better than a day too late, like I say all the time. And so she's like, wait, so you took good days away from your dog? And so I was startled. I thought I was going to get all this, you know, love and support. And so I knew she came at it, you know, she was still grieving. And so she's like, you stole good days from your dog. And so I said, yes, I did. But what I also did is stole a lot of bad days. And that's how I have to look at it, is I have to suffer so she does not. And I will be always sad. I wish I had every single minute. That's why it's never long enough. But I can pillow my head at night knowing I did her right. I still miss that little girl.
Kathy, I think this is a good segue. Wants to know how to find a vet like you in her area.
So great question. A few ways. One, at Lap of Love, you know, you could just go to our website and put in your zip code. And if we service that area, up will come. But we also, Lisa, just created a new directory, and hold on, I'm going to put it out there for you. It's called In-Home Euthanasia Directory. A lot of people spell euthanasia wrong, so let me help. But it's inhomeeuthanasiadirectory.com, and so it's not just Lap of Love. So any veterinarian who offers this service can make a profile for free, and so that way, if it's an area that we don't cover, or we are fully committed and you need to find somebody else. So I'm going to put that right over here. Look at, I'm multitasking like you are, Pam. So that is our new directory, which we just launched this past month. Also, many mobile veterinarians do this. They go to homes, right? The only problem with mobile veterinarians, and I love them, is that they usually are very booked out. So Lisa, did you know 70% of our families that call us need help within 24 hours? They wait to the end. So we are very like urgent care model, and we get booked up fast. But these mobile vets are already booked out 2 weeks because they're doing everything else as well. They're doing vaccines and ear stuff and whatever. So so they may not be as available. And so you could just search many different ways. Or also, ask your veterinarian. Not all can leave their clinic. So either insurance-wise, they can't leave their clinic, or they just are busy. Like when I worked in general practice, I was there 10 hours a day, and I was busy seeing 3 or 4 patients an hour. So I could not leave to go help a family at their house. But some do. So always check with your veterinarian to see if it's an option. And a lot of times our dogs are bigger dogs, right? That can't get in the car. They've got mobility issues. They're painful. So absolutely plan for this and talk with the provider in your area, so that way you understand when they're not available or when they are available.
So we certainly have.
Oh, that's so good. You see what Jacqueline just wrote? I'll read it to you, Lisa.
Yeah, there you go.
I'm going to steal this because this is so good. My vet says it's better to say goodbye when you're sorry to see them go, rather than say goodbye when you are glad to let them go, to like see them go. That's good. You don't want almost the relief to be overwhelming. I think even though I let a lot of my pets go, before the last minute, I still felt relief, right? Because I was like, okay, I know they're not struggling anymore. So I've never had that like, oh, thank goodness. But you're so right. I would rather have someone be I call them the weeble wobbles, Lisa. So I go to homes where they're like, they know it's time and they're like, please come as soon as you can. And I hate those because I just don't want people to have regret. And then there's those that are, it's way early and I support the decision, but the weeble wobbles are like, we don't know, it's kind of, they're bad, but they're good. And they're in between. And I said, this is good because it's not so evident. It's not so obvious that it's time, which means, again, you're suffering, so they never have to. And sometimes I can't even do that. And I'm a hospice veterinarian, right? I'm first a mom. I am first a dog and cat mom.
Right. Wow, this has been really great and informative, and it's a topic that that I think really is helpful to talk about and to understand better. And so we just really appreciate the valuable information that you've shared. And I can see from all of the comments that people really do appreciate your passion for the topic and your compassion. And we certainly appreciate your sharing all of that and your great work with us.
I thank you so much. I love doing these webinars with you guys because I know that all that are watching are people like me that love, like we started, the weak and the wobbly, the skinny and the stinky, the lumpy and the gray muzzles, right? They're the best kind ever. And I'm so happy when families are able to adopt a senior pet. That's the only ones I adopt now are the oldies. Sometimes the jalopies, as I say, right?
There you go. And I just wanted to express condolences to Jacqueline, who lost her dog on Saturday. It's obviously a timely topic, and we know how it is to say goodbye. All right, I see one last something here.
One last look.
Yeah, thank you. Lots of thank yous and much gratitude. So I think we'll end there. And I just want to say thank you again. And thank you to all of the folks who tuned in. As I said, you'll get a link to a recording of the webinar, and we'll include the links that Dr. Gardner included in the chat so that if you'd like to follow up on those, you certainly can. And we look forward to our next webinars, and we look forward to having Dr. Gardner back again.
Anytime. I love it here.
All right.
Thank you, everybody.
So much. All right. Have a good afternoon, everyone. Take care. Bye-bye.
Bye.